Reflexology. I'm just sitting out here in my yard getting some grounding in and also working on my own feet. And so I wanted to show you guys how to do that for the reflexes to the trachea and the bronchial tubes and even down into the lungs. So if you have not seen the video for the throat and the sinuses, you can scroll down until you find the link to the blog called Viruses Are Zombie Pirates. And the videos for the reflexes to the upper respiratory passageways are there, and so this is going to give you the lower respiratory. I am also going to be posting some things very soon on just stress and relaxation. So if you can sit in a chair or sit cross-legged on the ground, you can pull your foot up into your lap, or you can just lean over and work with your foot more on the ground, or you could ask somebody to help you out. There are a couple of different reflexes for the bronchial tubes. One is right here along the edge of the inside edge of the foot. If you go up in here, you're going to hit the spinal reflex, but just a little to the bottom of that, you're going to want to start working in a circular pattern and moving towards the toe. And then you're going to want to end up just on this, the bottom of the ball of the big toe. And I would do that 2 or 3 times at least. You can also use an inchworm movement or kind of a rock and slide to make sure that you get the whole thing. Some charts show the bronchial tube reflex on the opposite side of the ball of the foot, and so you're going to want to start just along the bottom of the pad there and go up between the bones of the big toe and the next toe, again with a push and roll moving upwards. You may want to use your other hand. And stop and work any spot that is a little bit tender. It's a little bit tender right here on me, so I'm just going to work that a little bit extra, a little bit more deeply. Now, as I was working this on myself earlier, it actually made me start to cough, and that would be a possible expected response. You're working the reflexes to the trachea and the bronchial tubes, and those are coated with mucus and little fine hairs that are pushing particles up and out, and just general everyday life causes them to get a little bit gunked up. I right now am suffering from some seasonal allergies, so I've got some sinus drainage, a little bit of just kind of asthma symptoms, and so this is actually helping with that and cleaning that out. So that would be a possible expected response from just about anybody, unless you are a runner or a opera singer or something where you've got your tubes are really cleared out anyway. The reflex for the chest and the chest cavity would be primarily the large pad below the main toes, and I'm just going to recommend going in some straight lines all the way across and then all the way back. Do that a few times. You're hitting the shoulder reflex there. If you go up high enough, you'll be hitting the sinus reflexes also. Then I go maybe in some diagonal directions. At the same time, your back fingers will also be hitting the top part of your foot, and it also can affect the chest And so you can just work that a little bit extra as well. Well, thanks everyone for watching. Let me know in the comments how this helped you. As always, remember that reflexology is not a substitute for medical advice and cannot diagnose or cure any disease, especially online. Reflexology is an extremely safe, complementary therapy, but keep in mind that by following these practices, you assume your own risk. I'd love to work with you in person, so come see me after our stay-home restrictions are lifted. And please click the Call Now button or fill out the contact form if you'd like to schedule a personalized online self-care session or purchase gift certificates at a discount. Be at peace, take care of yourself, and God bless you.